Branagan-Harris. I'm the CEO of Device Access UK. Device Access is based on the University of Southampton Science Park, and what we do is we help to get great technologies to patients faster. The technologies are medical technologies, and we work predominantly with North American medical device companies and diagnostic companies, and assist them in getting a national recommendation and approvals into the national health system through NICE, which is the National Institute of Health and Care Excellence. What NICE do is, NICE's role is to look for the most clinically effective, cost-effective and safest medical devices. I help to broker the relationship with the medical device companies and NICE, and to date we've helped to get over 30 technologies into the NHS through NICE's recommendations. Very fond of Hampshire, lived here a lot of my life, and would never consider going anywhere else really in terms of its location, with it being, you know, so accessible with the train lines into London. If you want to go to London, Heathrow Airport's Terminal 5 is not far away, and then you've got the good infrastructure down here. But the quality of life down here, having the New Forest, the Test Valley, wonderful cities like Winchester on your doorstep, it's a great place to have a business and to be part of Hampshire. Hampshire is a good place for business for its location in the country. It's good value for money. I think having a place in the country which is so accessible from a transport and link perspective. And, you know, the University of Southampton Science Park is a great place to have a business from the sort of community there and its location and accessibility. COVID-19 has affected probably, you know, everybody's lives really. And for the industry that I'm in, which is medical devices, it's been a very interesting sort of time really, because, you know, you're hearing on the news all the time about ventilators and diagnostics. That's the world I've been in for over 30 years, and for 10 years been running Device Access. So I'm sort of inside that whole world. And I suppose, how's it affected the business? Well, initially there were some companies that we were working with that we'd agreed to do some work with that had sort of slowed down a bit on their decision making. But as time went on and there was more confidence in the future for medtech, things changed. And I'd rather describe the industry we're in as a really exciting one, because if you were a defence force, if you were an army, navy or an air force and you'd had an attack on you like this, then you would invest in better early warning systems and better ways of defending and protecting the livelihoods of people in the country. So, and we saw, and we continue to see huge investment into the medical device space. So the industry is doing really well. You know, if you think about us versus the pharmaceutical industry that are still developing vaccines, it's been the medical device industry that's been at the forefront. I think that the future for the industry is looking really good. Healthcare systems around the world are all going to have to deal with extended waiting lists, because for the last 3 to 4 months, elective surgery or non-emergency have been cancelled, and each country, including our own, is going to see a huge waiting list issue and huge need to get through millions of backlogged patients. So we're going to see a lot of activity as soon as things start turning up. You know, all hospitals, all healthcare systems in the world are going to have to think of newer ways to treat patients. Ideally, trying to bring the rate of day surgery up from what it is. 70% of cases in the NHS are done in day case at the moment. So we anticipate with newer treatments and technologies that are less invasive, like keyhole surgery, to result in a whole boost of investment and a rethink on how hospitals across the world, particularly in the UK, are going to have to think differently about being more effective and more productive in getting through these patients that are waiting. So I think that's where we are with it in terms of the industry. It's going to be an exciting future.